Well, I was talking earlier this morning about the calls that I get, the emails that I get about the flu season and about these flu shots. Well, Dr. Joseph Cherneskie is the medical director, great hospital, Bristol Hospital's Med Help Urgent Care Center, and I have him live on the phone right now. Doctor, thank you for being with me.
Thank you, Brad. Good morning.
Boy, I'll tell you, good morning. I have, this year, I've had more calls on flu shots, and what surprises me, Doctor, is a lot of parents don't want their children to have these flu shots. What is the cause?
There's a lot of misinformation, but unfortunately, children are one of the highest risk groups for the flu and its complications, and it's unfortunate that a lot of this is being perpetuated, but it's very important for these children to get the shots.
Now, what is it? I could never figure out the reason that they don't want their kids to have the flu shots, but as you say, it is important. And what about the flu vaccination for all children? Is there any danger at all?
None that's ever been recognized. There's a lot of different concepts of whether the parents want the child to grow their own immunity, whether they're afraid of the contents of the vaccines. But they, like I said, are absolutely safe, and I don't think you would find any physician anywhere telling you that they are not.
Well, that's the reason I wanted you here, because there are some that say that you can get the flu from the flu shots. I had a couple of calls, a couple of parents called me on that one morning, and I can't believe that you can get the flu from a flu shot.
No, that's not true at all. Except for the nasal form of the vaccine, all flu shots contain an inactivated or a dead virus that cannot transmit the flu. The problem really is in the timing of the vaccines. Since these vaccines are given in early fall and early winter, that's the time of the year where there are a lot of upper respiratory infections circulating. And it's just by chance that you pick up one of these viruses by accident, and you kind of try to blame it on the flu shot. But the flu shot, if you would have gotten it, you would have gotten sick anyhow because it was just one of the viruses that were circulating. You cannot get the flu from the flu shot, period.
Well, I'm happy. I believe that. I've always believed it. But it just seems, Dr. Cherneskie, that this year I've been getting more calls. Now, is there a particular time that you should get that flu shot? You shouldn't wait. Is that correct?
No, you should get it as soon as it's available. We used to primarily give it starting in October, but it's certainly been available for several months now. The thing is, you want to have the immunity built up in your system by the time the flu comes around. And we don't know when the flu comes. But it takes sometimes 2 weeks for you to develop the immunity from the shot. So it lasts the whole year long. So there's no reason to wait to get the shot.
You know, another thing, too, with all of the immigrant children coming into the United States, this is another situation where I have received so many calls, and I've had a couple of doctors, and you are the third now, and they've said to me that they are not bringing things in here. This is what some of my listeners said. Gosh, I know that this disease is up, this disease, and it's because of the children that we are letting in here. I don't know where it all starts, but I've had more calls on that too.
The flu comes every year. It goes around the world, and it has nothing to do with anything like that. But the vaccine is still important today as it was last year. So
you're saying the children should have the vaccine, and it can be given right now. You don't have to wait.
No, unless there is a real good reason why the child shouldn't. Certainly children less than 6 months should not get the vaccine. And that's what makes it important for the adults, because if the young child cannot get the vaccine, then we like to vaccinate everyone around the child so that the flu is not transmitted.
You know, Dr. Cherneskie, I want you to know and your staff to know at Bristol Hospital, you'd be surprised the number of calls that I get from that area of the state from people that have been to the hospital, and one woman said to me, Brad, you have no idea how they treat us. It's just like family. And I said, well, I'm going to pass it along. I knew you were going to be on my program, so that's just one. And it's a great service. So I'm hoping that you being here this morning, that there'll be many parents that are listening that will change their minds and make sure that the children get the flu shot.
Absolutely. We recommend it highly.
Okay, thank you, Doctor. I appreciate you being with me this morning.
And thanks for having me on, Brad.
Dr. Joseph Cherneskie, Bristol Hospital's Med Help Urgent Care Center. And just be sure, the Farmington Avenue, Bristol number 539. Okay, 539, that's the address. And the website, 860-314-6046. You got it? 860-314-6046, bristolhospital.org, if you want to get a hold of the hospital.